Are you confused about health care? A lot of people aren't exactly sure what the new laws and rules will mean to them. But here is what we do know. Nobody wants to get sick, and nobody wants to go broke trying to get healthy. Within the next couple of years, a lot of people will have to buy health insurance, which sounds like it could be a little expensive and scary, especially if you're living on a very tight budget. Healthcare may be the new American dream, but there are things you can do to reduce costs and save some cash. And here to help us out to do just that is Craig Cohan from First Horizon M-Saver. He's here as part of our My Money series. Good morning.
Good morning. How are you?
I'm doing great. Thanks for being here.
Great to be here.
This is really an important conversation here this morning. A lot of people out there are always looking for saving money and really covering the whole family when it comes to health care. But it's so expensive. I mean, everybody just thinks, my God, what are we going to do here? How do we save money, Craig?
You know, one of the options that a lot of consumers are considering is a health savings account, or HSA.
And I've heard about it. What exactly is a health savings account?
Well, an HSA is pretty simple.
Okay.
It has two parts. One is it has a traditional health insurance plan that is HSA qualified, and the second part is an HSA bank account.
All right, and I guess in layman terms, tell me the benefits of having one as opposed to maybe something else.
Right. Well, the benefits are fairly simple. Because you have an HSA qualified health plan, traditionally the health insurance premiums are much less than what you're paying today.
Can you also take it maybe from one job to another? Because a lot of people sometimes can't do that.
You know, that's the beauty of an HSA. It has many benefits. Because you're contributing into the HSA bank account, it's your money, and you can take it with you from job to job.
So you actually have a little bit more control, if you will.
You do have a lot of control. Again, because it's your money, you have control of how that money is spent, how you invest that money, and then how you save for your healthcare future.
Love that. Now, how does a person qualify for this?
All Americans qualify for an HSA,
Okay.
Other than those that are on Medicare.
And what about something that I read here, and sometimes the terminology can be a little iffy for a lot of people. What is a high deductible health plan?
A HSA high deductible health plan is a health plan that has a $1,200 single deductible and a $2,400 family deductible.
All right, and one of the things I always look for is coverage. What exactly is covered? Because it's myself, my husband, my kids, and I would say that's a lot of people out there, you know, the entire family. What benefits, what coverage do we have?
It's all the traditional medical coverage that you would see under your HSA health plan,
Okay.
plus things that might not be covered, like dental, vision, chiropractic, prescription drugs.
Prescription drugs as well?
Covered.
Okay.
Emergency room visits, doctor's office visits. So anything that is considered a qualified medical expense is covered under your HSA.
And what if you decide to use the money for something that's non-medical? Can you? Should you?
Not a good idea. If you use the money for a non-qualified medical expense, you're going to pay ordinary income, and then you're going to pay a penalty on top of that withdrawal.
All right, so let's come full circle here. Fill in the blanks for me. If I were to say, all right, Craig, I'm interested. I'm thinking of getting an HSA. Tell me why.
First, you're going to save money. You're going to save money on your health insurance premium. Secondly, you're going to be able to make tax-deductible contributions into the HSA bank account. You're going to have the availability of that money to roll over from year to year and make another contribution the second year. And most importantly, you're saving for your healthcare future when you need those healthcare dollars the most.
Great information. Craig, thank you so much. I'm really going to look into it.
Thank you.
Appreciate your time.
Thank you.
And when we come back, we're going to meet a mom who has managed to save a bundle, she says, thanks to her switch to an HSA. So stay with us. Welcome back, everyone. Before the break, we were talking about the benefits of health savings accounts, or HSAs, and helping you find ways to save money on health care. Well, now we found a mom who's made the switch to an HSA, and she's here to talk about her experience. Her name is Sandy Santino, and we thank you so much for being here.
Thank you for having me.
Now, Sandy, before we talk about your switch, tell us about your family.
Well, I have two wonderful little girls.
Oh, so do I.
Katie Ella, who is 9, and Sophia Isabella, who is 6, with my husband, Kevin, of 14 years.
Okay, so you obviously need health care for your family.
Absolutely.
Very important. And you made the switch to a health savings account. What did you have before, if I may ask?
I had a traditional health plan that a lot of people have with co-pays for doctors and pharmacy, deductibles for hospitals, and the cover of the catastrophic expenses.
And how has this switch made a difference for the entire family?
You know, it's made a tremendous difference in three main areas. One, the premium savings. We save on our premiums every month.
Okay.
Two is the tax savings, because you're using pre-tax dollars that grow tax-free in your HSA account to pay for expenses. And my kids are always getting sick or always getting hurt, and so those expenses add up. And the third area is it allows us to become better consumers of health care. Now we look at what it costs to go to the hospital, and we compare the pricing so we get the best value for our dollar, because it's our money we're spending.
It seems like you have more control when you have a health savings account.
Absolutely.
Like you are kind of like the boss, if you will.
Absolutely, absolutely. You're more concerned about what you're spending because it's your money. And also, you know, you want to engage in healthier lifestyles because you want to remain healthy. You want to eat healthy,
Sure.
exercise, and, you know, do more preventative measures to keep you and your family healthy.
Now, let's talk about money here. If you know, because maybe you don't, but how much money do you feel you've saved from making the switch?
I feel I've saved, you know, thousands of dollars over the years between the premium savings and the tax savings, because a lot of items that we don't even think about, you know, the dentist, vision providers, non-covered medical expenses that are eligible expenses under an HSA, you can use your money pre-tax to pay for those costs. And so it's significant savings over their lifetime.
That's excellent. And why else would you tell our audience or even friends out there or myself to make the switch?
Well, one, the premium savings, like I said. Two, the tax savings. But three, you want to secure your health care future. You can keep your HSA for life. So there'll be expenses that Medicare does not cover, and you'll need to have some funds to cover those expenses. So it's another vehicle to save for your future health care costs.
And in this day and age where people are just wondering what they're going to do, this could be a pretty good option for them.
Absolutely, absolutely.
Thank you so much for your time.
Thank you for having me.
I really appreciate it. And
Thank
good
you.
luck to you and your family.
Thank you.
And for our viewers at home, to find out more answers to your questions about health savings account, just visit the website, and that's www.firsthorizonmsaver.com.